we're talking about little things that can cue us in a little bit better too. And you've hinted at this a little bit, but from a testing perspective, if we're thinking, if there's any little bit in the back of our head that's going, this is a gross motor delay. This is a kid who's got maybe a gross motor delay and some intellectual disability and some behavioral aggression or anything like that. And I'm thinking, well, maybe I should go to a neurologist. Maybe I can't rule this out specifically. Are there tests that you guys want to see before that happens, or are there tests that I could do, and then I should immediately pick up the phone and go, oh my gosh, Dr. Panda, what am I going to do with this kid?
Right, I think we kind of touched upon this before, right? So CK, the creatine kinase, that's one of the simplest and easiest thing that you could do in your office. Because I've spoken to some pediatricians here, they say, I've never done a CK level in my office ever. It's kind of interesting to hear that, but I think CK, that's a key thing. It's going to be really high in 10,000s, 20,000s in these boys with Duchenne, and there's nothing else that causes that high of a CK in these boys with, other than Duchenne. So that's one of the key thing. And if you see that number, if you get your phone and call me, I'm seeing this patient right away the next couple of days to kind of proceed with further testing and exam and other things.
Awesome.
So again, CK, just keep that in
Yeah.
mind. It's a simple, easy test, maybe $1 or $2
Yeah.
test that you could easily do.
For sure. So are there utilities in other testing too? You mentioned before that a lot of these kids will have a kind of a much larger workup as they're going through this process too sometimes, or when we're not immediately thinking about Duchenne. So are there other tests that are valuable alongside that? Should we be looking at liver enzymes alongside these kids? Should we be looking at those LFTs? Should we be looking at kidney function or anything like that? Or really, all of that gets done later, and CK is the one piece that you need.
Right, I think a lot CK is a
Hmm.
key, right? And these kids can have high liver enzymes because some of the liver enzymes like your AST and ALT, they're also coming from the muscle. So I see the opposite side. I think pediatricians, you can correct me if I'm wrong. You tend to do a lot more LFTs than a CK in the office. So when these kids get these LFTs drawn as part of their routine visit, there's an AST, ALT high. Or they automatically refer them to either you guys repeat it or you automatically refer them to a
Hmm.
gastroenterologist. I would probably say just add on a CK to kind of differentiate if that AST and ALT is coming from the muscle or is it from the liver. And then, of course, you can also do a GGT that kind of differentiates. The GGT comes only from the liver. That can also kind of differentiate that. So I think, again, going back to your question, if you're doing a liver function test, AST and ALT, if they're high, just add on a CK again to see if there is something coming from muscle. And apart from that, to me, CK, that's the only thing that's going to help me. I don't necessarily need any other blood test before they come see me.
Gotcha. Awesome. Yeah. And I
Yeah.
think I think you said a good thing there, right? If we're gonna poke and we're going to get blood work on this young kid anyways, add on a CK. We don't have to do it again later. We don't need a second poke. We're gonna get the blood anyways. So add on a CK level to that and see what it looks like.